Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. And the good news department is open. Why? Well, we had a man, 70 years old, an Italian-American professor in the university. He came to us in the year 2000 with prostate cancer, PSA 17, high-risk cancer, PSA, prostatic specific antigen 17. He looked at all his options. Even back then, we showed people the data. And back then and today, if you have open surgery or robotic surgery for a PSA 17 prostate cancer, the success rate is about 60%, with the vast majority of men losing ability to have sexual intercourse, unable to have erections adequate for penetration, and many men, actually around 80%, with urinary problems. Well, he didn't go the surgery route. He came with us, treated in the stereotactic frame and brachytherapy, and now his PSA is 0.01 in remission 14 years after treatment, with no further treatments than just our 26 treatments. His sex life is working 14 years after treatment at age 70. Pretty good, right? His urinary life is working pretty good, right? Age 70 after treatment, cancer free. So he's happy. He thinks it's normal. Of course, many people with cancer in remission thinks it's normal. Others might view it as a miracle. I'm very happy for him. I'm happy for us. And how do we get our data? Someone asked me a few weeks ago, well, how do you get your data? Well, you do it one patient at a time. Contact the patients, get their PSAs, document the PSAs, document their condition, and then put it all into computer log, and that's how we get our data. Most facilities don't even keep track of their data. Well, we keep track. We follow our patients. We want to know what's going on. Why? Because it makes us better physicians. And then when we meet with you, we can present with you and tell you exactly what the data is. So feel free, if you want the data, come in. Again, we have a new prostate cancer book, and we'll be happy to send that to you. Or you can pick it up at our office, 1384 Broadway and 38th Street, a spacious, modern cancer treatment center on Broadway, just between Macy's and Times Square. And we know there's 50 million people who come to Times Square, so it's about a 2-minute walk from Times Square down. Pick up the booklet. Again, it's a private cancer center, so there's no miles of cold corridors and strange faces and locked doors. No, we know who you are, and we treat you like you belong, hopefully like the President of the United States, of your body. And we just had a woman come in, 61 years old, with a lump in the breast. For 6 or 7 months, she's been wondering what to do, seeing some doctors, afraid of most everything. She saw one doctor, wanted to give her surgery and chemo and hormones and radiation to both breasts. Well, we saw her just a couple days ago on a Thursday. She came to us. Yes, she had a lump in the inner portion of the right breast, just medial or towards the inside portion, inside from the nipple area. It was about 1.8 centimeters, so about 2/3 of an inch. She'd had no biopsy. She was really, I think, petrified, but talked to her, explained the options, got her seen immediately that day, had a needle placed in the breast. That was Thursday afternoon. By Monday morning, she had the answer. Can you imagine that? After waiting more than 6 months, came in, same day, biopsy, had the answer. No cutting, no bleeding. She had the answer, and now she can make her decision knowing what is in the breast. So it's so important. If you have a lump in your breast or someplace else and you don't know what it is, you may want to find out. We don't want you to be like that police officer who has bilateral breast cancer with the cancer eating through the breast. No, we want to create, if we can, an early diagnosis, an effective treatment, keep your body intact. If it's breast cancer, hopefully you'll choose the treatment of your choice, and hopefully you'll follow the data, and the data shows better results with lumpectomy and radiation. We'll be happy to show you that data if you wish to come in. Another good news department. One man just treated a few months ago for a Gleason 7 cancer. Gleason 7 is how the cancer appears under the microscope. He had a PSA 8.5 when he started. He was petrified. He was a very slender man, and he had started on testosterone, which probably stimulated some of the cancer in the prostate. One of his doctors advised him to have surgery. Well, if you look at our booklet for Gleason 7 cancer, in the best hands in America, the results are 60% for Gleason 7 with surgery, 90% with us. What would you choose? He chose us. He's in remission. His PSA is already reduced by about 90%. He is happy. I'm happy. Even our data is happy. And there's another article that was just published in the New York Times, which is very interesting and curious, by Nicholas Baclalar. It was published in the New York Times, and Nicholas wrote, a new study adds to the evidence that low-dose aspirin, known to reduce the risk for heart disease, may also reduce the risk for pancreatic cancer. Now, pancreas cancer has a 93% fatality rate, and the National Cancer Institute estimates there'll be about 46,000 cases and 40,000 deaths. So in this study, which was published in Cancer Epidemiology, researchers compared aspirin use in 362 pancreas cancer patients with 690 randomly chosen controls. The participants were asked about past and regular use of aspirin, defined as at least once a week for 3 months. They controlled for age, sex, race, smoking, diabetes, and other variables, and found that regular aspirin lowered the risk for pancreas cancer by 48%. Now, patients who had been taking aspirin for 1 to 3 years reduced their risk by 43%. Those who had been taking it for 7 to 20 years, 56% reduction in pancreas cancer. Why? Why would aspirin reduce the incidence of pancreas cancer? Well, the senior author said, we don't know, and that's a fair answer. We don't know, but it's an observation that seems strong, and there's actually similar data in breast cancer, which reported on this show several weeks ago from the United States and from Great Britain, that aspirin also reduces the death rate of breast cancer. So it may be something that you're interested in pursuing. It's certainly a low-cost alternative. It has side effects, so you may want to talk to your physician or come in and talk to us about it. I'm not selling aspirin. I'm not selling it, but it's an observation that may reduce pancreas cancer, which is one of the leading causes of cancer and of death in the United States. But another man, speaking of prostate cancer, like we were doing just a few minutes ago, 61-year-old black man, electrician with 4 kids. He was diagnosed 3 years ago at another facility, at a hospital, one of the big hospitals in New York. At that time, his PSA went from 8 to 12. He had a Gleason 7 cancer. He's had no treatment. Okay, so he's got a Gleason 7. Gleason 7 is how it appears under the microscope. Dr. Gleason tried to put a scale together to be able to tell you and doctors and others what kind of cancer you have. Is it a low-risk cancer or high-risk cancer? And as you know, Gleason more than 6 is considered a higher risk. So this man had a Gleason 7, which is a higher risk, and his PSA was more than 10, so that's considered higher risk. So he's a higher risk patient. He came to us, and obviously for Gleason 7s with surgery, the success rate, as we told you before, is about 60%. For us, it's about 90%. And if you open up our booklet, you can actually see the data for surgery. Some people think that if you have surgery and you take out the prostate, you take out the cancer, and you're home free. That's one of the biggest fallacies in history. no one's home free, or at least very few people are home free. So if you remember, this man had a PSA 12, Gleason 7. So if you look at the data, us versus one of the most famous surgeons in Baltimore, for PSA 10 to 20, surgical results are 72%. We're at 86%, which is 19% better. And look at this data. If you have surgery in Baltimore, at a famous place, for PSA 10 to 20, the 5-year chance of being cancer-free is 72%. At 10 years, it's only 30%. Meaning 70% of men with PSA 10 to 20 have recurrence of their cancer after surgery in probably the best hands in America. Wow. So it should teach us all that if you have prostate cancer and you have the prostate removed, the likelihood of being cancer-free is not so great, especially if you have PSA 10 to 20. Only 30% of men are cancer-free. If you have PSA more than 20, only 28% are cancer-free. And look at this data, and this is all from page 6 of our prostate cancer booklet, which we'll be happy to give to you if you come into our office or call in. For Gleason 7 cancer at 10 years, with surgery in the best hands in America, and robotic surgery is no different, the success rate is 46%, which means that 54% of men with Gleason 7 cancer have recurrence of their cancer after surgery. And we know that our data is substantially better both at 5 years and 10 years. And look at this. For Gleason 8, 9, 10, at 5 years, if the surgeon removes the prostate, so he obviously thinks the cancer's in the prostate only, otherwise he wouldn't do the surgery, right? At 5 years, the cancer-free survival is 41% for Gleason 8, 9, 10. At 10 years, only 23%. So the vast majority, almost 80% of men with Gleason 8, 9, 10 prostate cancer have surgery, the cancer comes back. 80% it comes back. So it should tell you something, that while you think that surgery would work, actually look at the data, and there's been tens of thousands of men who had surgery, so you should learn from the data. It's a lousy option. And if you look in our booklet also at quality of life, sexual function, and urinary function, surgery is pretty lousy. Wow, it's a lot to think about. Makes you wonder what's going on. We're going to stop for just a moment, hear from our voices about work that we do in Radiosurgery New York. This is Dr. Lederman. If you have questions, please call us at 212-CHOICES. That's 212-246-4237. If you have cancer issues or want to be seen, we promise to see you within one business day if you need that. Again, we accept most insurances, Medicare, Medicaid. Our goal is to provide great medical care to you. We also have hyperthermia. Hyperthermia is a way of heating cancers to help treatment be even more effective. So we're going to hear from these voices, and they'll be right back to answer your questions.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function and your life. Most insurances,